I just interviewed Dr. Sharon Stills. She had some incredible insights about brain fog and Alzheimer's and how hormones play an important role, and shared with us her approach on optimizing hormones and the many other factors that go into that optimization. So definitely stay tuned towards the very end, where she shares some controversial viewpoints on cholesterol and hormone replacement therapy. Peace and plants. It is my pleasure to introduce Dr. Sharon Stills, a licensed naturopathic medical doctor with over 2 decades of dedicated service in transforming women's health, and has been a guiding light for perimenopausal and menopausal women, empowering them to reinvent, explore, and rediscover their vitality and zest for life. Her philosophy is reinvent your health, explore your spirit, and discover your sexy. This unique approach has revolutionized the way women experience their transformative years, making her a sought-after expert in the field. She's a proud graduate of the Sonoran University class of 2001 with a rich background in European biological medicine, pro-aging therapies, and bioidentical hormone replacement. Dr. Stills has successfully guided thousands of women through gentle transitions using all-natural method. Her expertise is recognized globally, evidenced by her invitation to take part as the co-lead North American lecturer for the Paracelsus Academy in Switzerland. She is also a longtime contributor as a physician expert at the Women's Health Network. Her influence is also felt in academia and professional circles, sitting on the boards of the Bioregulatory Medicine Institute and the Archive of Healing at UCLA. Dr. Stills continues to share her knowledge through the annual Mastering Your Menopause Transition Summit and as the former host of the Science of Self-Healing podcast. The opening of the Lasting Wellness Center, her new 7,000 square foot clinic in sunny Scottsdale, Arizona in fall of 2025, marks another milestone in her mission to provide unparalleled naturopathic care. So without further ado, let me introduce Dr. Sharon Stills. Dr. Stills, you are an expert on many different areas as a naturopath, including hormones. And what is your approach to hormones for patients with brain fog or Alzheimer's or other brain conditions? What is your philosophy?
Yeah, my philosophy is hormones first. So hormones are such a huge player. And if we think about Alzheimer's, we think about the predominance being women, the predominance happening after they lose their estrogen, after they go through menopause. And I've been practicing for 23 years and actually went to naturopathic medical school to be a pediatrician. And when I came out of school, you know, you make plans and the universe has other ideas for you. And so I ended up specializing in oncology and in women's health, and specifically bioidentical hormones, because Suzanne Summers had written her book. Patient came in and was like, I want what she's having. And so I was a little taken aback because I knew Suzanne Summers as Chrissy from Three's Company, but everyone wants to be a doctor. But I read her book and I was like, wow, she was in her initial journey, she started out working with Dr. Jonathan Wright, who was one of my mentors and taught me. And he, to me, I think a lot of people have forgotten him, but he is the father of bioidentical hormone therapy, wrote the first script for Biest and is brilliant. He's now retired. But that's who I learned from. And so I just saw that women, when they're going through that menopausal, perimenopausal transition and are just losing it. They're losing their mental capacity. They're losing their emotional balance. They commonly come in and say, I don't feel like myself. I feel like I'm going crazy. I can't remember names. I can't focus. I can't get my work done. And it's scary, especially if they have an elderly family member who has gone through Alzheimer's. It's very scary to watch. All diseases are difficult, chronic illness, cancer, but when you see someone you love losing their mental capacity, it's freaky, right? It totally freaks us out. And we're like, we want to do everything we can to not have to go there. And so I, I started specializing in hormones. And I think we tend to, as a society, we think about hormones as like our sex drive, as, for women, as our menstrual cycle, for having babies, for getting pregnant. And we totally forget that hormones play an integral role in our bones, in our cardiovascular system, in our brains, in our lungs, in our gut, in our genitourinary tract, like everywhere. And they're modulating our immune system. They're modulating our cardiovascular system. They're modulating our moods and our memory. And so I find very good results. So I kind of have developed this hormone first approach, and I'm trained I'm a naturopathic medical doctor, so I went to school here, but I have trained extensively from when I was a medical student back in the late 90s over in Europe in European biological medicine. And so I'm a very terrain-based physician. And so I don't just throw hormones and forget about everything else, but I find when we put the hormones in first and we do it properly, a lot of things get better. And then we can go in and tweak and detox what needs to be detoxed, or upregulate what needs to be upregulated. And if we really go through like all the hormones, we see they have such a powerful role, not just estrogen, because I think estrogen is, in the realm is like pretty well thought of. I mean, Dr. Lisa Mosconi, the neuroscientist from, I think she's out of Cornell, wrote the book, The Menopausal Brain, and really focuses on how the estrogen receptors, when the estrogen is going down, the receptors are like going wild because they're just trying to find estrogen, and the correlation with
Right.
Alzheimer's and dementia. And so, but I think, we forget about like progesterone and testosterone and pregnenolone and DHEA and thyroid and adrenal hormones and melatonin. And these also have really, and we can go through, but these also have really powerful effects on the brain. And so I see it turn around things like significantly. Hormone proper, and we could talk if you want me to dive into like what I mean by proper hormone replacement, because I have a lot of very strong views on this. When you do hormone replacement properly, it can be pretty quick. It's not like you have no hormones and now it's going to take us 3 years to rebuild your hormones. It can happen in a week. I mean, I have patients that I just saw a patient this afternoon, my first patient of the day, and she is 78 or 79. And I just put her on hormones. I saw her like maybe 5-6 weeks ago. And her first thing was that she said, she's like, I'm going to do whatever you say to do, because I have had to use pharmaceutical sleeping pills my whole, the last 30-40 years. And she's like, I don't need to use them anymore.
Oh, that's a beautiful story. So it raises so many questions for me. One is, I know you practice not just in the United States, but also in Switzerland or Europe. Is there a different approach to hormone replacement or management in Europe as opposed to the United States?
It's a good question. So actually, no offense to my European peeps, I find that we do hormones better here in the States, but Europe does everything else better, like chronic illness, autoimmune disease, cancer, the biological terrain way of thinking. Although it's definitely come around, because when I started going over to Europe in the late 90s, we were talking about the impact of dentistry and amalgams and root canals and galvanic currents and cavitations and how you shouldn't use titanium implants. And that was nowhere to be heard here. And now in the States, biological dentistry has come a long way. We were doing neural therapy. We were doing a lot of terrain things and drainage. And so it's definitely come over more this way. But when it comes to hormones, I think we have better compounding pharmacies. We have better laboratory testing. And so a lot of what I learned, I credit into how I practice from my studies overseas. But when it comes to hormones, I actually learned a lot of what I learned here from my original mentor, Dr. Jonathan Wright, and also just being in clinical practice. Like,
Right.
you're a practicing doctor, and
Yes.
I learn from my patients every day, still 23 years doing it. And I still learn from my patients. And there's a big difference between like what you read in a book and what makes sense, and then what actually happens. And like a hormonal example of that is DHEA. If you take DHEA, it's going to turn into testosterone. Uh, but it rarely does in clinical practice. Like, most people need DHEA and testosterone. It's not enough to give DHEA, even though physiologically and biochemically it makes sense. So I'm really, I love learning and looking at the science, but I'm a real, like, in the clinicianal, just doing what patients need. And so I often find I'll do things, and then like 5-10 years later there'll be a study like saying what I was saying anyway.
Right, which is awesome, which means you're at the cutting edge and you're willing to do the research and find the best treatments out there, so you don't have to wait decades for it to make it into textbooks. But that leads to my next question, which, you and I have been using bioidentical hormone therapy for a long time, but my understanding is most physicians in the United States are not. Do you think that's a fair statement? I mean, among people who think like us, yes, but I keep running into patients who are frustrated that their endocrinologist will not prescribe bioidentical. Are you running into the same thing?
Yeah, it's really sad. And I hear this so often. And sometimes I just cry because I see women, like, I've been really educating about, like, it's never too late. So now I have all these fantastic women who are like in their 70s, their 80s. I had a 94-year-old new patient the other day, and they're like, I want hormones. And, there's a lot of bad information about out there, like it's too late, you can do more damage. But you have to remember, like, when they say, oh, if you don't start hormones for 10 years and then you take estrogen with progesterone, it can increase your risk of dementia. You have to remember, they're not talking about bioidentical. They're talking about synthetic. They're talking about progestins. And comparing progesterone to progestins is like comparing an apple to a monkey. It's not even an apple to an
Right, right,
orange.
right. But to understand that difference, you actually have to understand the biochemistry and the structure, and I think that's why the general public has no chance unless,
Yeah.
I mean, you want them to do their own research, but most of them are not going to go and study organic chemistry and these structures.
Yeah, I mean, it's just been this, like, we had that Women's Health Initiative study, and it's like still permeates the way doctors think, which is crazy because it's been debunked. It's been shown it wasn't a good study. It wasn't an interpreted well study. And it's still, I hear it all the time. And there is a very big difference. Like, when I'm talking about hormones, I'm talking about bioidentical hormones. And these are just like that. They are biologically identical to what your body produced. They're not these synthetic hormones that I wouldn't touch with a 10-foot pole. And even within bioidentical hormones, that there's just because it's bioidentical, it doesn't mean it's a clean compounded hormone, right? So you can get bioidentical progesterone, and it's called prometrium, but it's compounded with peanut oil. And that peanut oil is definitely rancid. It's definitely GMO. A lot of times they come, and I learned this the hard way, like, oh my God, like over 20 years ago. Because when I first started practicing, I was in my early 30s and I wasn't going through menopause, but I had all these women I was taking through menopause. And one of them, like, and I was compounding for them. And she brought her progesterone capsule in and she opened it up. And I was like, why is that orange? Like it was artificially colored. And I was like, oh, this is not okay. So now I'm like, I drive my compounding pharmacy crazy because I'm like, what's in this? Wait, why is that? Like, this is not okay. You can't put parabens in oxytocin nasal spray because parabens are toxic. So I'm constantly reformulating, recompounding. We fill our hormones with acidophilus, which is just a beneficial bacteria. So, the take home message is like, if you are getting compounded hormones from your physician, that's great. Make sure you're kind of nudging them or calling the pharmacy and make sure they're clean. There's different bases. There's different ways because, I don't like to be like crazy and zealous. Like if it was like something you were going to take for a week, whatever, your body can handle it. But bioidentical hormones, you're going to take for the rest of your life if you want to keep getting the benefit. Because patients often say, how long do I have to do this for, Dr. Stills? I'm like, for as long as you want to feel good, because it's a normal process that your hormones, like I always say, your ovaries are like, peace out. We're going
Right.
to Hawaii. We've done our job. We're going to the hammock. And so it's normal. Like I had a patient today, we were looking at her baseline tests and she was like, oh my God, is it normal? Like all you keep saying is my levels are low, my levels are low. And I said, yeah, I said it would probably be, more abnormal if you had like robust levels and you're 67. I'd be
Right.
scratching my head going, how is this happening? So it's a normal transition. It's not a disease, but we live a lot longer. And we have this, I mean, the women, we are like, I don't know, what is it, like a billion strong? It's like some large amount of women who are going through menopause like now and through the next 5 years because of like the baby boomers and Gen X. And so we have this like amazing opportunity to change the whole societal perception of what it means to age. And to me, that's like super exciting.
It is, and I'm curious. Going back to, obviously, you don't want to compound these hormones in rancid peanut oil. What do you use instead?
So, like for our progesterone capsules, use a vegetarian capsule and we put acidophilus in with our progesterone. So, our creams, we do very pure creams that you can use. I'm always looking to make it pure and cleaner as much as possible. Like I don't prescribe estradiol patches for numerous reasons, but from a toxicity perspective, there's a lot of plastics and toxins that are with your estradiol dripping into your body that you're wearing continually. So now, of course, if that's all you can get, it might, you have to weigh everything. But we, there are different kinds of estrogens. And so like estradiol is important, but so is estriol, which is E3. It's very anti-inflammatory. I use it to treat cancer, brain cancer, glioblastomas. Like it is an important estrogen. And you can't assume that just because you're taking estradiol, you're going to go to estriol in a pathway. You can go to estrone, which is very inflammatory. So these things need to be looked at, and often they're not looked at. The typical thing, so to go back to your initial question, like are doctors giving out bioidentical hormones? No. And if they are, and if they are, a lot of them, like the more progressive OBGYNs, they're giving you an estradiol patch and they're giving you a progesterone capsule. And they're not monitoring you. They're not looking at metabolism. They're not paying attention to pregnenolone or testosterone or oxytocin or DHEA or thyroid hormone. Like that's one of the, I can go on like a total soapbox about thyroid. And what are some of the symptoms of low thyroid hormone? Foggy thinking, depression, memory changes, all these signs of dementia are, low thyroid hormone. So the hormones are huge for brain health.
Right, which is amazing because you think of the brain as the master endocrine organ that's directing some of these or all of these different hormones, but it turns out if the brain's not doing a good job directing these hormones, the brain itself is then injured. So it's an interesting feedback loop. Let me ask you this, Dr. Stills. So I went to a lecture, one of my classmates from Harvard, Dr. Sarazal, was basically saying that for women going through menopause, there's a window, an optimal window where you want to start hormone replacement. And I understand what you said is like it's never too late, but when is the right time to start? I guess that's a related question.
The right time to start is to really think about, so perimenopause. And perimenopause is this period of time where you're transitioning to menopause. So what is menopause? It's a year without your cycle. So menopause is like one day. You get to a year without your period and you're like, I'm in menopause. And then the next day you're postmenopausal. So it's just a calendar thing. But up until that moment, you're in perimenopause. And some women, it can be very peaceful, very fine. If you pregame and you are on top of your hormones like I was, or it can be a very erratic roller coaster because especially your estrogen can be doing like the roller coaster ride. And so taking that back a step further, if you are a woman who has had hormonal issues, and that could be PMS, that could be breast tenderness and bloating before your cycle that we all think is normal, but it's not normal, just common. That could be having difficulty getting pregnant. That could be having migraines. That can be having fibroids. That can be having PCOS. That can be having endometriosis. That can be having anything that is like a hormonal symptom. That means your hormones are off. And so the best time is right then and there. Like my last patient tonight, she's a 28-year-old girl, and we are working on her hormones because she's got some cycle issues and she wants to have a baby in a few years. So if you're not having any of those kind of hormone symptoms, then when you are 40, get a baseline, because the average age of menopause is about 50, 51. But that means that some are going to go earlier and some, that's the average. So getting a thumbprint at when you're 40, even if you're asymptomatic, because sometimes your hormones are dropping and you're not really symptomatic. And so the best time to start replacing might be then, because if your estrogen is dropping and your progesterone is dropping, it's affecting your brain and your bones and your arteries. And so the sooner you can start replenishing, the sooner you're going to be preventative. But that being said, it truly is never too late. I see it all the time in clinical practice. And so like if you're listening and you're 65 and it's been, 13 years since you have a period, like it's not too late. You can still get help. You can still get benefit. But if you're listening and you're younger or you have younger women in your life, like with anything, right? Prevention is always the way to go. Like me personally, so I was in my early 30s.
Yep.
Treating all these women with menopause. I'm watching them like age backwards in front of my eyes. And I'm like sitting there with the worst PMS. I had like such bad hormones. And so I started practicing what I preach and started fixing my hormones, which balancing your hormones as a cycling woman is different than balancing your hormones as a menopausal woman. But because I did that and balanced and fixed my hormones, when I went through menopause, I never even had a hot flash. Like I freaking love being in menopause. I feel the best. Like every year just gets better. I feel great. If you said to me, I can wave a wand and you can go back to be 25, I'd be like, yeah, no, thank you. I'll stay right where I am at 57. I'm perfectly happy here. So it's something that you can be on top of and something you can take control of. You just need to find someone to help you who understands what they're doing.
That's awesome. And earlier, Dr. Stills, you mentioned terrain. And for those of our audience who haven't heard that term before, what do you mean by terrain? I mean, obviously, terrain is the environment, but what do you mean there?
So I think, the internal milieu is one way to
Sure.
say it, the biological terrain, the matrix, the ground cell, the ground matrix, the extracellular space. So basically, we spend a lot of time focused on the cell. We spend a lot of time focused on the mitochondria. But the way I describe it is the cells, if they're soup, and we'll say vegetable soup for you.
Thanks.
So the cells are, carrots, and they're soaking in the vegetable soup. And it's the soup, it's the water, it's the spaces between the cells where the cells are getting their information. And so this is truly, this extracellular space is truly, to me, where health begins and health ends. It's where we have flow in our body. It's where our lymphatic system flows. It's where our fascia is. It's where we can look at mineralization and pH. It's the interconnection between the external terrain and nature and what's going on and our internal. So the mitochondria are actually getting information from this extracellular space. And if we take it to the brain, then we have the lymph of the brain, which is the glymph. And this is how you detox your brain. And that doesn't happen unless you sleep. And you have to get into a real sleep. A light sleep's not going to do it. You got to get into that deep sleep. You can also tilt the head of your bed a little. So you've got that incline going. But that's why sleep is, I always say sleep is a superpower. And if you're not sleeping, you're not healing. And my experience, especially with women, I mean, with men too, but if the hormones are depleted, then they're not sleeping. And so that is the first thing we have to focus on. Now, it can also be an adrenal issue. It could be a thyroid issue. It can be a lifestyle issue. It can be trauma and nervous system dysregulation. So, I'd say when I give someone hormones and, for sleep, we need estrogen. Estrogen helps tryptophan go to 5-HTP to serotonin. And we need progesterone, and progesterone orally. So I give progesterone as cream and capsule because it has different mechanisms of action. But the oral progesterone is like hormonal Xanax. And because of the way it breaks down into allopregnanolone and it hits our brakes, it hits the GABA receptors. So I would say I don't know, 70, 75%, 80% women that I get on the proper estrogen, progesterone, they are sleeping. And sometimes 100 milligrams is enough. And sometimes you have to titrate it up and they need 200 or 300 or 400. But there's, probably another 20, 25%. It helps them, but it doesn't knock it out of the park. And I'm only interested in knocking out of the park and having optimal health. And so then we have to dig a little deeper. Is there a blood glucose issue? Is there a high cortisol issue? Is the hypothalamic pituitary axis having a bad game of telephone and not communicating? Is there low thyroid? Is there just bad sleep hygiene? Are you eating too late? Are you staring at your computer? Are you not wearing blue blockers? Do you not go outside? Do you not put your feet on the ground? Do you have trauma? Do you have, if we look at it from a traditional Chinese medicine perspective or even an Ayurvedic perspective, if we have an inability to settle, to be still, then we can wake up in the middle of the night because our vata energy is deranged, or if our liver is congested. A lot of people wake up between that 1 and 3 where they have liver issues. That's the time of the liver. Or they're waking up, between 3 and 5. That's the time of the lungs. That can be related to grief. And so we're complicated as human beings. And so sometimes, you take some progesterone and that's it. You go to sleep and you have a good night's sleep every night. And sometimes we have to dig a little deeper.
Awesome. So, Dr. Stills, one thing I run into with many patients with brain fog and Alzheimer's is high levels of endocrine disruptors, whether it's PCBs, plastics, certain mold toxins like ZEA are all endocrine disruptors. So they're disrupting the very system that you're trying to optimize. So my question to you is, how often do you test for endocrine disruptors at the same time that you're testing for estrogen or progesterone or testosterone? And if you do test for them, help me understand if that's important or how that changes your thinking, right? Because you may be trying to get the optimal progesterone amount, but if they're endocrine disruptors affecting the hormone receptors, I feel like you may only be looking at one part of the system. So help me understand how you fit it all together.
Oh yeah, I'm doing a ton of testing, and I'm looking at endocrine disruptors, especially in younger women, because that can often be why they're not producing proper hormones, or why their hormones are gunking up or not having an effect at the cellular receptor site. When they're older, again, it's the winding down of the ovaries and they're not producing hormones. So in that case, I'm getting their hormones balanced first, and then we're going in and looking, what do we need to clean up? What are you overloaded in? And so I'm not only looking at mold, I'm looking at heavy metals, I'm cleaning up their mouth, I'm looking at environmental toxins, glyphosate, I'm doing organic acid testing, I'm looking at infections, I'm doing extensive blood work. Now we have the whole COVID, post-COVID, whether it be someone who had COVID and it's kicked up latent infections, or someone who has a vaccine injury and is kicking out spike protein. So there's lots of different pieces that we have to put in that go into, I'm looking at a lot of nervous system regulation, because especially women, when they get to menopause, like I write menopause with a parentheses around the word pause, because like we know it means the cessation of your menstrual cycle, but I'm like, this is like a beautiful golden opportunity to just like exhale and pause, because a lot of women like have been going in a trauma response, and they're just so overburdened and overstressed and trying to overachieve and trying to do their career and their family and their community and their spouse and their aging parents. And it's like, sometimes we just got to exhale and just have a reset. And it's a beautiful time to do this, because there really is a lot of truth to, with age comes wisdom. Like sometimes I just sit there and I just go, gosh, like it's really true. It just happens. You get older, you get wiser.
But one day it happened. Yeah.
Just like magically. And so we have to look at those things too, because the mind and the body are, the energetics of the body. And, so I do a lot of work with color and modulating biophotons. We do photobiomodulation. So we put helmets on patients, and we do neurovisor training and to re-stimulate neuroplasticity. So I'm really approaching it from a lot of different levels. I just find that when we can get the hormones on board, it makes it a lot easier to show up and be present for the other work you need to do. Because if you're a woman who's depleted in your hormones, it can truly feel like you're going crazy. You can truly feel like I need to check into the psych ward.
That's been my experience too. Let me ask you, so you start with optimizing the hormones, you make all these changes. Do often you have to go back and adjust the doses of some of these hormones based on if you've cleaned up one thing or optimized something else that has an impact?
Yeah, and again, it depends whether you're postmenopausal or you're perimenopausal or you're younger, because I don't know about you. I work with, like, I end up seeing a woman, and then I see your husband, and then I see your kids, and so I have patients. I mean, I've been doing this a long time. So, like, I just had a 28-year-old patient. I've known her since she was like 5, and now she get married, and we're talking about having a baby. Oh, so I work with patients of all ages, so it really depends. But I'm, always monitoring and making adjustments. When you're postmenopausal, the adjustments are fewer and frequent. It's more of a static kind of thing, but it can change if you have a major stress or you get rid of a major stress, if you have a major change in your diet. I mean, if you are cleansing out, like, we are going to offer EBOO, which is extracorporeal blood ozone and oxygenation, in our new clinic. And that's really, that's like dialysis, ozone dialysis, and really cleaning the blood. So you go through something like that and it drops your toxic load significantly. And then you do need to relook at these things.
That's awesome. So I know you're opening up a new clinic soon, and I can tell you're at the cutting edge. You're always looking for new technologies, new techniques. Is there, going to conferences, is there any new approach or new technology that you see coming down the pike in the next 6 months that excites you? Like, oh, I can't, besides EBOO, is there anything else where you're like, I can't wait until I'm in my new clinic and I can do, what is it?
Oh gosh, color puncture, like, working with patients and putting color into their bodies. EBOO, we have an amortal chamber, so we're going to be doing PMF, red light therapy, inhaled molecular hydrogen, vibroacoustics, and guided meditation. I'm really excited about that. I'm really excited. We have a oxygen bathtub, which is a much more comfortable way, like, rather than going in a HBOT chamber, you can just
Right.
soak in a hydrogen.
Using the hydrogen bubbles. Yeah, I love that technique.
Yeah. Yeah. So, I mean, it's funny because like, my son, who I practice with, he's like, you cannot purchase any more equipment.
No more
Because
toys.
I'm a woman. So it's like, if I'm not going, like, to go shopping and buy new clothes, I'm a doctor woman. So I'm like, at the conferences, I want to buy that. I want to buy that. And right now, as our clinic's being built, my house is just like, there's so many machines and things here. So we're looking forward to having a place to put them. And, we have a magnetic field chair coming in from Switzerland to support the pelvic floor. So we have lots of, something for everything. And then on the flip side of that, it's like you also just go back to, like, basic naturopathic medicine. We're going to be doing hydrotherapy and nipe wraps, and, just because you can't, like I always say, you can't, if your hormones are depleted, if you're postmenopausal, you're not going to eat or supplement or sleep or move your way to hormones. You need to really take bioidenticals. But if you are just taking those and you are not doing all the other things, you're doing a disservice to yourself. And so health truly is like this multifactorial event. And it's really important that we do all the things to stay healthy. And, I truly believe that our bodies are meant to live to 120. And because I do a lot of prolonged fasting, I upped it. I'm going to live to 130.
All right. Good
I gave
job.
myself extra 10 years, but it's just about, a lot of it is mindset. And we have to, I think about, when my parents, were my age, they were old.
Right.
Right. And, I'm not old. I'm like, I'm just bebopping and doing my thing and I feel great. And if you take care of yourself, there's no, I know 70, 80, 90-year-olds. I figure my whole thing is like when I get to 100, I'm going to relax on the porch and probably not do too much. But until then, there's a lot that I have to get done and want to do and want to contribute and give back and so forth. And I'm no one special. Like, I do not have a strong constitution. I was very sick as a child all the way into my early 20s till I started taking health into my own hands and learning about naturopathic medicine. So I always say, like, if I can do it, like, anyone can do it, because it didn't come easy for me.
That's a great story, Dr. Stills. We've covered so many different topics and areas of advice related to how you can fix brain fog, Alzheimer's, and other conditions with hormones. What do you think are, say, the top 3 points that you made?
Well, there's one point that I didn't make that
Okay,
I'll use as one of my 3.
perfect.
But
I like it.
because we didn't talk about cholesterol.
No, we
And
didn't.
cholesterol has like been made into this horrible villain, and we need cholesterol. It's the precursor for our hormones. And so, cholesterol turns into pregnenolone, and pregnenolone is a precursor to all the other hormones. And so it's definitely, we see aging is definitely associated with a decline in pregnenolone. And pregnenolone is like manna for the brain. It's so good for memory and for, influencing like acetylcholine release. And so I just want to leave you with thinking, like, if your doctor's been telling you your cholesterol's too high because it's 200 and it needs to be 130, that's not a good thing. I spend more time in my practice raising people's cholesterol than I do lowering it, because low cholesterol is a sign of increased mortality, and it's a sign of, can be a big contributing factor to dementia, to problems. And so we just need to like change the way we think about cholesterol and not be just like so I think there's 3, like, we shouldn't be afraid of cholesterol. We shouldn't be afraid of estrogen, as long as it is the right kind of estrogens in the right form. You don't want to take oral estrogens. You want to make sure you're balancing with your estriol, which is really anti-inflammatory. And I'm not sure how much it has to do with brain, but I think I always talk about like the 3, like cholesterol, estrogen, and stomach acid, right? Because everyone's trying to suppress, everyone's on an acid blocker. And
Right.
usually the issue is they don't have enough stomach acid.
Right. And we see that acid blockers are associated with the development of Alzheimer's or
Oh, so
dementia.
there you go.
So long term, you don't want to do that. Now, you raise this interesting question. You said don't focus on cholesterol, but instead of raising up the cholesterol, can't you just supplement with the pregnenolone?
You can, but cholesterol is a component of all your cells, and it makes for fluidity and to get nutrients in and toxins out. And so one of the things I was taught by one of my mentors, and I have seen over the years, because I do a lot of work with oncology patients, is someone has a normal cholesterol, and normal cholesterol used to be a lot higher before they wanted to sell more cholesterol meds. But someone whose cholesterol like plummets for no reason, it's like, that's a sign of like severe oxidative stress and can be a sign of a tumor brewing. And so I'm always looking at that. And someone who has a low cholesterol could be a sign of liver issues. And so I just had a patient today who, like, we were looking at her blood work and her cholesterol went from like 148 to like 185. And I was like, woohoo! So much healthier to have a more robust cholesterol, to have that fluidity for your brain and all your cells.
Got it. And Dr. Stills, how can people find you, both in the real world and on social media, if they want to contact you?
So, well, our new center is called Lasting Wellness Center, but my website is drstills.com, and we will have a website for Lasting Wellness Center, but drstills.com is always a good place to go. And then, Dr. Sharon Stills, I guess on social media, I guess Instagram is where I do my best to hang out. Every time I'm interviewing, I'm like, I'm really trying to be more on social media. But if you go to drstills.com and you sign up for my email, my newsletter, like, you'll get a download. And even if it's a download you're not interested in getting, it'll put you on my email list. And that's where I am the most prolific. We are constantly educating, emailing, talking about where I'll be speaking, what I'm involved with. So my email community is near and dear to my heart. I do a lot of free webinars, and it all gets announced in the email.
Wow. So, Dr. Stills, thank you for your expertise, for sharing your time with us, and your dedication to this field. It's so important, and it's truly an honor to meet someone who is making things happen, is helping so many patients improve their lives.
Oh, thank you. Pleasure's mine. Thank you for inviting me to be here and share with your audience.